this is Becky, and Becky comes every 6 months. Becky wears a denture, and Becky is one of our favorite patients. So Dad is going to just give us some tips of parents out there, or caregivers, how he takes care of Becky's teeth. All righty then.
Okay, so the first thing we have to do is we have to take your teeth out. Open.
Good job, Becky.
Open.
Dad's gonna help you.
Okay, open your mouth. Open. We brush.
You get nice and clean, huh, Becky?
Brush. Yeah, I know, just relax. Open your mouth. Let's see what we got down here. Just
Almost
open your
done.
mouth. I got you right there. Oh, look at that. Aren't you good? Huh?
Sparkly
Okay,
clean.
hold still. Hold still. Hold still.
Becky, you're so pretty. You're doing a great job.
Okay, open your mouth. Open your mouth. There we go. We'll get all the gunk out.
There we go.
Are y'all done?
Perfect.
Pretty much done.
Oh, what about the denture? How do you take care of the denture?
Well, we wash the denture out.
Okay.
And then every night we put it in with one of the denture cleaning, the Polydent equivalent, whatever they call them, Efferdent or whatever.
Okay, great.
And she soaks it overnight, and then in the morning when we get ready to go, we warm the water up and we warm the denture up, and in the mouth it goes.
All right. Well, thank you
Are
so
you
much.
ready?
These are the tools that have helped me provide a better dental cleaning on the patients, which is the bite block. You put it between the teeth, and the brush. This one reaches way back over here, this brush. And this helps too, because their tongue kind of wanders, so it's a tongue, I just call it a tongue stopper. So it just kind of basically stops the tongue from touching the teeth while you brush or take a picture.
The advice I'd give is just to tell them to be really patient, and it's not necessarily about getting everything off, like all the plaque off, but just keeping them comfortable, because that will help establish trust between you and them. I think that's the biggest thing, and then you can make more progression if they have trust with you. The biggest challenge for me was learning the cues of they're uncomfortable, because some of them, can't verbally tell me that they're uncomfortable. So the hardest part was knowing signs to look for that they're not comfortable, and different ways to keep them comfortable. That was the biggest challenge for me, I think.
As a caregiver, one of the recommendations I can tell you right now is to be patient with the residents. I know sometimes it's hard to convince them to brush their teeth, but if we be patient, I know this is a big challenge, because I know some of the residents are hard, they don't want to do it, but we have to be patient and focus what really is necessary for them and for their wellness.
You're a great caregiver, and I'm glad you're here today with your sister-in-law. I have a question. Do you have any favorite products that you think that works for Debbie?
Debbie has a very small mouth.
Correct.
And what we have found is that, and we found that out through you all here, is a smaller toothbrush. And the electric one works better. And the reason being is because Debbie's special needs, when she's brushing, if she has to do this, all of a sudden she sees something shiny or, just stops, and so her teeth don't get brushed. Using a very small head with the electric toothbrush, she is much more in tune, and she waits for it to beep, and she knows it's got to beep 4 times, and then she's done.
Okay.
So that helps, and she can count to 4, so she gets that. So
that's really
cool.
helpful.
Cody was just hard. He was just hard. So basically, he was so tactile sensitive that we had to really just think outside the box. And even though we couldn't get all of his teeth brushed at one time, we would brush a little bit at one point, come back, brush them again. And it was just tough and to be patient with him because he was so tactile sensitive. It started when he was a baby that he would be laying down to get his diaper changed, and I would have a toothbrush and just brush a few teeth while I changed his diaper. And to this day, he carries toothbrushes with him because of when we started young with him, changing his diaper.
I think the biggest advice that I would give is to make sure that they're comfortable. Try to, put Vaseline around their lips and be careful about pulling on their cheeks, because as soon as the resident becomes uncomfortable, they become a lot less cooperative than they even would have been before. So just try and keep them as comfortable as you can, and kind of think about it as if it were your own mouth. Are you brushing too hard, or when you're flossing using the interdental picks, like, are you pushing it towards the gums or up away from the gums? Just try to keep them comfortable.
So I will say that I started very early, and when we would shower, as I got them out of the shower, I would wrap them in a towel. So I kind of contain them, and then I would come from behind and brush their teeth. I think, first of all, just the consistency. Every day we did it. And so they knew that it was coming, and I felt like I had more control because I would wrap them in a towel. And it wasn't like I was holding them down. It was kind of like I was drying them. And then I could come from behind where their arms couldn't help. And then I would brush their teeth. And I've not had a lot of problems with either one of my boys. I started just very early doing it, and it's an everyday thing. Even today when they're older, my oldest is gonna be 32 in October, and my youngest is 13. And they still brush their teeth in the shower. That's still a thing with them, I feel like it's just been consistency.
Do they use a manual toothbrush? Do they feel more comfortable with an electric toothbrush? What has worked best for them? And what would you suggest as a mother?
With Marcus, he does not like the electric toothbrush. We tried it, but it was too much stimulation, so I always stayed with the manual toothbrush with him. Luke also uses a manual toothbrush, but he has braces, so I did incorporate a water pick, and he's okay with that. Luke is a little more high functioning on the spectrum, so that he doesn't get as freaked out over the sounds and the new vibrations. So he'll let me use the water pick.
Now, also interesting enough, both of your boys have had braces. What suggestions would you give a parent who is contemplating should they look about getting their kids braces?
With Marcus, his braces we put on because he didn't start talking until he was 12, and his doctors felt like braces would be helping him to expand that palate and help guide his tongue. That wasn't a great experience for us. He continually took them off like 40 times. The orthodontist informed me that he was the worst patient he ever had. But, I think it was just the feel of it was too much for him to deal with. We made it through in 2 years, and he could never wear a retainer. So it's kind of gone back to the beginning, but it accomplished what it needed to accomplish. With Luke, he's been great. He had him on. He kind of looks forward to it. He gets excited about picking the color, all the regular things that teenagers like. And he's very independent is an understatement for him. So I just think it depends. And I didn't think Marcus would do well with braces, but I followed the doctor's orders and we tried.
I have home hygiene products that I recommend for people who are struggling with home care due to the taste and textures of traditional products, which are bubblegum and peppermint flavored toothpaste, mouthwash, dental floss, and the FF 500 plus prescription dental cream.
Does your mom have to remind you sometimes? Yeah. But when she reminds you, do you do it?
Yeah.
Yeah, that's awesome. That's why you look so good, huh? And are you able to floss them with the little flossers?
Yeah.
And does your mom ever have to help you do that?
Yes.
Yeah? And is that okay that your mom sometimes has to help you do that? Absolutely, right? As long as it gets done, right?
Yeah.
Do you feel like your teeth are healthier now that you're cleaning them more?
Yeah.
Yeah? And do you like that?
Yeah, I do.
Was it kind of hard at first to do that?
Yeah.
But then you got used to it?
Yeah.
Yeah? Well, awesome. What about Mom? Does Mom have any suggestions of anything for him to add?
Skylar has a terrible gag reflex that he began with when he was probably 16 years old. It just came out of the blue. He has Down syndrome. I don't really know what all of a sudden became the issue. So dentistry wasn't a problem until then. Since then, it's been horrible. He has gags when we brush his teeth. It's hard to get in there and really get his teeth brushed well. And so finally we found Dr. Brooke after years of searching. Thankfully, she has the patience and the stick-to-itiveness to help Skylar through his issues. He can go in there and see her and gags very seldom. Counting helps a lot. Even brushing his teeth at home now is more successful.
Do you think that us counting with those numbers, do you think the numbers helped with that?
Yeah, I do.
Yeah. Does it kind of give you something else to think about while we're cleaning?
I say clean, yeah.
Yeah.